Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I am your host. I'm Dr. Celeste Reese-Willis. I'm a board-certified family medicine physician. I'm also an Amazon best-selling author and national speaker. I assist busy professionals to find healthcare solutions for both their acute and chronic medical needs through my virtual telemedicine program, as well as my concierge medicine program. So good afternoon, ladies and gentlemen. We're sorry for coming on a little bit late. We had a few technical difficulties, but excited to update you a little bit on what's going on and the latest with COVID-19. Hi, Dr. Jaquel. Thank you so much for joining us. So, ladies and gentlemen, I thought what we'd do today is talk a little bit about a subject that's been in the media a lot, especially with, at this point, I know that there are about 30 states that are starting to decrease some of their guidelines and allow and relax some of their stay-at-home orders. So I thought what might be a great thing is for us to discuss this wearing of this mask or cloth covering that's been recommended by the CDC, and us talking specifically about how to wear that mask, when to wear it, and why we are wearing it. So the first thing we'll do is tackle, okay, why are we wearing a mask or cloth covering? And let me make sure that we're clear here. We're not speaking of the surgical mask or the N95 mask that's needed for healthcare workers. Please don't go out and get those. We want you to either make a cloth covering. I know that there are a lot of people that are actually making cloth covering. One of my sisters and sorority sisters and good friend of mine made cloth coverings mask for me specifically, that I'm able to put my little N95 inside the cloth covering when I'm working. But when I'm just out and about, I will wear just the cloth covering. So why are we masking up? So the first is what we're trying to do is we're trying to protect ourselves, and we also are trying to protect other people. We know that COVID-19 is passed through respiratory droplets, primarily when someone coughs or sneezes, but it can also be when someone talks. It's also been discovered that people are able to pass the virus when they're what we call pre-symptomatic. And what that means is the first studies have shown for about 48 to 72 hours in some patients that are asymptomatic, they're actually able to spread the virus to other people, that they're contagious during that time period. So this wearing of the cloth covering will help us to protect one another when we're out in the community. Now, so when we're doing the mask, what we're trying to do is cover your nose. We want to cover your nose and we want to cover your mouth. The virus can pass between individuals when they're in close proximity to each other, even if the patient or the person is not exhibiting symptoms. I want to make sure that we stress that, because a lot of times I've had patients ask me this week, I've seen people out both in urgent care and just in a social setting, grocery store setting, and a lot of people are not, some people, however, are not wearing any kind of cloth covering or mask. So the reason why we want to do that, so why mask up, is that even if someone is not exhibiting symptoms, it is possible for them to pass COVID-19. So whenever we wear that mask or cloth covering, we're helping to protect those people that are around us from any respiratory droplets that we might exhibit. And of course, no one would purposefully be around someone if they knew that they're sick, but this is to kind of catch that little subset of individuals that may be passing virus and may be contagious in that 48 to 72 hour window prior to them actually exhibiting symptoms. So that's part of the reason why we'd like you to wear the mask. Now, so let's talk about how we're going to wear this cloth covering or mask. You want to make sure that it is a snug fit against the side of your face, because we want to make sure it's covered, and you want to make sure your nose and your mouth are covered. I have seen people out and they have them and they'll keep them over their mouth, but they won't keep it on their nose, and that is actually putting you at a little bit of risk, and those individuals around you a little bit at risk. So you want to make sure your cloth covering covers your nose and your mouth. It's a snug fit against the side of your face. You want to secure it with some kind of tie or an ear loop, and you want to make sure that you have multiple layers of fabric with that cloth covering. Just putting a t-shirt up over the nose and mouth, I've seen that as well, is not sufficient. in terms of helping to provide you with a layer of protection. You want to make sure that when you place it, though, that you don't do anything to restrict your breathing. Now, we know that the mandate has been no one under the age of 2 years old and no one who has severe respiratory issues or disease, and definitely no one that is on oxygen should be covering their face with a mask or with a facial covering. Definitely not in a 2-year-old or younger. You want to make sure that you clean that cloth covering. So you want to make sure you wash it, machine wash it, and that you dry it so that we know that it's clean. And so someone asks, okay, Dr. Celeste, so how often do I clean my mask, the cloth covering or mask that I've made? So you want to make sure that you clean it as frequently. It depends on how frequently you use it. If you're someone that's following social distancing, staying in and at home, and let's say you just go out to go to the grocery store just one time, you may not have to wash it then, especially if it's a trip. You go there, you come back within, 30, 40 minutes, or even, there and back within an hour or so. Maybe not so much. But if you've used it routinely, you just want to make sure that it's clean, and you have to yourself kind of judge that. If you just go to the grocery store, may not need to wash it then, machine wash it then. But if you use it all day, let's say that you're someone that is an essential worker, or you have to work right now, you want to make sure that you clean that mask frequently. So next question is when do we want you to wear this cloth covering or this mask? And the answer to that is any time that you're in a public setting, most especially in a grocery store, a pharmacy, if you're having to do things with your house, if you go to Home Depot, Lowe's, you want to make sure anytime that you're out in a very public area, you are exposed to more possibility of people that may be passing along droplets of this COVID-19 virus. So you want to make sure that when you're in that public setting that you're definitely keeping your nose and your mouth covered. The entry points for this virus are the eyes, the nose, and the mouth. And so by keeping your mouth and your nose covered, you're protecting other people from any droplets that you can exhibit and helping to protect them. So we've talked about how, we've talked about when, and we talked about why. Now, someone asked the question, well, if I have this cloth covering on, then I don't need to do the social distancing, right? Absolutely not. Regardless of whether you have a cloth covering or not, still the biggest muscle in this fight against COVID-19 is the social distancing. Studies have shown if you're within 6 feet of someone that has it, they can pass off the droplet to you, and you increase the risk of getting it from them if you're within that 6 feet. If you're out in public and in grocery stores, you guys may be noticing that most of the floors are taped. They're using counters here in the state of Alabama when you go inside and outside of stores because they're trying to control the crowd and the number of people that are exposed at one time. I would encourage you to follow those guidelines. If you get in line and let's just say that someone is not practicing social distance and they walk up within that 6 feet radius, you can very kindly take a backward saunter or take a couple of steps back. Basically 6 feet is about 2 arms lengths. So you want to make sure you're at least that far along. You don't need a tape measure. Just make sure, okay, they need to be at least 2 arms lengths away from me. And if they're not, just kindly, and it's not, you don't have to be rude, say, oh, I'm sorry, I'm practicing social distancing. Do you mind stepping back a little bit if you're in a situation where there's someone ahead of you and someone behind you? And sometimes people forget because they aren't thinking about it. They have a lot on their mind at the time. So just kind of remind them so that you can help to protect your space. You want 6 feet in between you and someone else. Now, someone else asked a question, okay, so if I'm with my family and friends, or if I'm with a group of friends, it's okay for us to be together as long as we have them in cloth and covering? No, absolutely not. Social distancing 6 feet from everyone that's not in your household. Without that, you increase the risk of you obtaining this virus, and that's what we're trying to mitigate, the risk of spread of this virus. So I would encourage you to kind of make this a habit for yourself. If you make it a habit and you do it a few times, it becomes a habit, right? If you do it enough and remind yourself of it, it becomes a habit. Unfortunately, until we develop a vaccine, and making an effective vaccine typically takes about 18 months to happen. So in the next 12 to 18 months, we're going to be practicing some of these things in a varied perspective, so to speak. But one of the things I would encourage you to make sure you get in your person is to make sure that you know, okay, I want to be 2 arms lengths away from anyone else. So the next question is, okay, Dr. Celeste, so how do I protect myself from this virus, especially with so many people opening things up, and as states and cities and different communities around the country are opening up, what can I do to protect myself? And so we're still going to come back to some of these same basic principles that we've been sharing with you over the last several weeks, which would include biggest muscle we have in the fight. Number 1 is social distance. That's 6 feet. I can't tell you how important that is. Number 2 is making sure you wash your hands often. Now, we talked about the why, when, and how of the mask. Once you remove the mask and let's say you drop it in the washing machine, you want to make sure that you wash your hands, right? Right, because we know that the virus can live on surfaces for up to 3 days. And so we want to make sure that we're washing our hands. Now, that's actually the second measure of how you can help to protect yourself as well, is washing your hands often. Making sure that you think about the things that you're doing in terms of making yourself think about, okay, I'm going to try not to touch my eyes, my nose, or my mouth. If you're someone that wears glasses, please make sure that you're washing your hands in between and cleaning the side of your glasses so that you haven't inadvertently been at the store, been out somewhere in public, and touched that area and not cleaned it, because the virus can live on that surface, up to 3 days. So we're washing our hands often. We're avoiding touching our eyes, our nose, or our mouth. That's another way you can avoid getting COVID-19. If you have to scratch your eye, your nose, anything like that, try to remind yourself to wash your hands in the meantime before you do that. You want to avoid close contact with people. Put distance in between yourself and other people. You want to make sure that you're covering your mouth in any private setting when you're with someone that's not within your home. If you're in a business meeting, and let's say you have to have a business meeting, don't feel weird. If it feels weird to you, just announce the elephant in the room at the beginning of the meeting. Hey, I'm practicing social distancing. I'm also following the cloth covering recommendation by the CDC, and most people will definitely understand that. You also want to make sure that you're cleaning and disinfecting your home. You want to make sure you're doing that, especially those frequently touched surfaces, doorknobs, refrigerator door handles, AirPods, headphones, things of that nature. You want to make sure you're cleaning and disinfecting those areas. Let's see. Any questions from anyone? Let's see who's logged on today. Hi, Miss Ellis. Thank you for joining. Hi, Miss Millie. Thank you so much for joining. Hi, Dr. Charlotte. And hi, my sister Rabia. Hi, how are you? Tell Harley and Zoe I said hello. Hi, Dr. Hassan. Thank you for joining. Hi, Dr. Janine. Thank you for tuning in with us. And Jermaine. Hey, Jermaine. Thank you so much for joining. And Miss Barnes. Hi. Thank you so much for tuning in. And Miss Black, thank you for taking time out of your schedule to join us today. And Miss Cable, may God richly bless you. Thank you so much. I appreciate that. So that's all I had to share today, ladies and gentlemen, just encouraging you to wear that mask. I can't tell you how important that is. We will follow back up with you on Sunday with a new topic of what's going on. Other than that, does anyone have any questions? If you have any questions, please feel free to put them in the chat. Any questions at all? Anyone have any interesting stories they want to share? Or anything to add or share with anyone that's listening today? I'm going to give it just a minute because sometimes it takes a while with our technology and crossing over. Oh, you're welcome, Dr. Janine. Thank you so much for taking time to tune in. Okay. Any questions? So just remember, guys, we're going to protect ourselves by social distancing. That's our biggest muscle. Secondly, we're going to do the cloth covering or the mask, handmade mask. Avoid touching our eyes, our nose, and our mouth. We're going to make sure that we clean and disinfect those frequently touched surfaces, and we're going to make sure that we avoid close contact with other individuals. Okay, let's see. Dr. Janine had a question. She said, do you need to wear a mask when walking in neighborhoods? Okay, no, I didn't address that. Thank you so much, Dr. Janine. So this is the deal with mask and exercise. the first thing is, if you're someone that's out there that has any chronic illnesses or comorbidities, I'm going to tell you first to make sure you talk to your doctor first. But just in general, if you're just taking a brisk walk and you want to wear a mask, that's okay. If you're in a nice open area and no one is around you, then that would be reasonable for you to not wear a cloth covering at that point. If you're exercising and you know that you're getting your heart rate up and running, it may be challenging for you to actually wear that mask and be able to breathe the whole time. And what I caution you with is you don't want to decrease your oxygen or cause respiratory distress and sue that into yourself by using the cloth covering when you're trying to struggle to breathe anyway to just keep up with exercising. So with intense exercise, definitely do not wear a cloth covering. A brisk walk through the neighborhood. If you start to feel like, I feel a little too short of breath, take the mask off. Take a few deep breaths. And you may need to leave it off for the remainder of that walk, but it's mainly when you're in close contact with other individuals. Yes, the respiratory droplets, we do know that they can exist in the air for about up to 3 hours, but generally when you're in an open space, there's decreased risk of that. When it's really, really concerning, or when you have to be most concerned, is when you're in a confined or enclosed space. Specifically, if you have a meeting with someone, it's a closed door meeting and it's you and that person, you want 6 feet and you want you and that person to have on a mask. When you wear the mask, you're really protecting that person that is in front of you from you. So you want them to wear a mask to help protect you from them. Again, obviously, if someone is sick, they would seek attention with their physician and not be around other people. So you definitely want to make sure if you're sick, if you're coughing, sneezing, you still want to make sure you're not doing it out in the open air. Make sure that you put it in a tissue, even in the privacy of your home. I encourage you to do that. And make sure that you wash your hands, okay? Let's see. What must do be rechecked? What must you do to be rechecked if you had COVID-19? What must you do to be rechecked? So the first thing that I would say there, Miss Cable, is where it depends on where you live. I don't know if you live in Alabama or not. If you're having a hard time finding somewhere to be checked, feel free to book a consult with me and we'll find somewhere. We have been seeing people across the country because the federal guidelines were released to allow physicians to practice across state guidelines during this quarantine period. And so we've been able to see people from different states. So if you need a consult or need to find somewhere to have a test, set up a consult with me. My website is in the chat and it's in the post rather, and then we will find you somewhere to have a COVID-19 test, because if you are positive for it, you definitely need to be rechecked or reassessed before you are around other individuals. And I would encourage you to continue to be quarantined until you're rechecked and we know that you're in a position to be around other individuals. Okay, you live in Montgomery. Okay, so, and I'm not sure whom you had your initial visit with, but if you book a consult with me, we'll be able to help you find someone to get that secondary test, because you definitely need it before you repopulate and definitely before you go back to work. Most employers are requiring that their employees, that especially if you've been sick, have testing beforehand, but there's some employers that before you return to work, they're asking you to have a COVID-19 test, and that depends on where you are, whom you work for, and what their guidelines are, and that's not something I would be able to answer for you, but you'd have to check with your employer about that one. Okay, you're very welcome. And if you're not able to find somewhere, or if you are, you aren't, contact me and I'll be able to help you find somewhere to have that test done. Anyone have any other questions? We're making sure that we're still doing the same basic things, making sure we're drinking plenty of water, we're exercising to build our immunity, multivitamins, including a vitamin D3, as well as exercising and trying to make fun times out of this kind of forced time that we're having alone and at home. But it's a time for us to reconnect with our families. That's a blessing of this time that we've had during the last 8 weeks or so. Anyone have any other questions before we go? And we'll make sure, if you guys come up with questions, we'll do a Q&A after the session on Sunday as well. But just really, 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 really want to encourage you to please, please wear that cloth covering. When you do that, you help to protect yourself and you help to protect others around you. And to be honest with you, that's what we're going to need to get over this and get through this. It's kind of like, if you guys remember, I'm aging myself when I do this, but I don't mind. Kind of like We Are the World from years past, back in the 80s, where it took everyone kind of coming together to kind of solve this problem. It's a similar thing with COVID-19, and how well we do with this depends on, how well we love on each other right now. And us loving on each other, which is so important right now, is us wearing that cloth covering and doing that social distancing. I cannot tell you how important that is. Does anyone have any other question? Hi, Sarah Allison. Thank you so much for tuning in. And hi to Tessa. Thank you so much for taking time out to join us today. Anyone have any other questions? We will come to you live on Sunday as well. So any questions that you have or develop in between now and then, please definitely remember those or write them down. And that's all. Again, we're wearing the mask to help to protect ourselves and protect other people. We're going to continue to social distance even when you have the cloth covering or mask on. If someone is around you and they're not doing that, you just want to remember you want 2 arms lengths ahead of you between you and that other individual. And if that person is not practicing it, all you have to do is very politely backward saunter, take a couple of steps back and just, hi, I'm practicing social distancing. I know that we live here in the South and, we're really big on manners and being polite. But really, to be honest with you, what being polite means right now and loving on people is keeping that 6 feet distance in between you. And so you can even make a joke about it that way. Hey, I'm just going to love on you really quick by getting away from you or keeping 6 feet from you. Not a bad way to enter into that by making a little joke. And again, if you are exercising, you want to make sure that you're careful about wearing the mask in that particular environment. If you have any lung issues at all, please consult your physician prior to exercising, or if you have questions about whether to exercise with or without the mask. If you can't get in with your physician, feel free to schedule a consultation with me. My website is in the chat. Okay, BJ Hair Biz. Thank you, Dr. Celeste. What foods and vitamins to build the immune system, care for elderly at home? Okay, great question. Okay, so what foods and vitamins? So let's go over. There's actually, I have a website, 5foodstofighttheflu.com. And so that's the number 5foodstofighttheflu.com. But you actually can get to it on my website as well. If you go to my website, I have a little PDF where I go over some foods that you can make a part of your diet. They help you fight the flu, right? But these are foods that help to help you to build up your immunity, like sweet potatoes and cauliflower. Vitamins, you want a multivitamin and vitamin D3. Very, very good for helping to build up your immunity and making sure you're drinking plenty of water. Water helps every cell in your body to work better. And so you want to make sure you're getting in a good amount of protein as well. Protein are building blocks for our body and for our immune system as well. Does anyone have any other questions? If not, then we will see you on Sunday. Bring your questions and we will have some more information to hopefully share with you. If this has been helpful for you, please feel free to share it with any of your friends. If you are in need of a consultation, again, you can book an appointment with me on my website. Other than that, ladies and gentlemen, again, I'm Dr. Celeste Reese-Willis. I am your board-certified family medicine physician, national speaker, and recent Amazon best-selling author of my brand new book, Vitality. And it's been a pleasure to be with you guys this afternoon. Have a great night. Bye-bye.